Today we are going to talk about the renal mechanisms for excreting concentrated urine. In our last lecture, we discussed about the ability of the kidney to excrete dilute urine. The human kidneys have the ability to excrete dilute urine or concentrated urine depending upon different physiological conditions. Now, why is it important to excrete concentrated urine? Because the human body is continuously losing water from the gastrointestinal tract, through the respiratory tract, through urine, through feces, in sweating, and through breathing. So we are continuously losing water, and to replenish that water and to maintain homeostasis, we need to continuously take the amount of water that is being lost. But apart from that, apart from taking water, the kidneys also help in conserving water. And if there is shortage of water, if the human beings are unable to take water, or if the loss of water from the body is more than the intake of water, then the kidneys come into action and they start conserving water by making concentrated urine. So as we previously discussed, that there are some certain areas in the human nephrons which are specialized in reabsorption of water or the reabsorption of sodium and other electrolytes. And there are some areas which are dependent on the secretion of antidiuretic hormone for the reabsorption of water. So the same mechanisms are used for both excretion of dilute and concentrated urine. If there is shortage of water, if there is more loss of water than intake of water, then the kidneys different action come into play. And what happens that the kidneys starts concentrating urine, and it start reabsorbing water, especially through the distal collecting tubule and cortical collecting tubule through the action of antidiuretic hormone. If there is no antidiuretic hormone, we see that the concentration of urine starts decreasing from 300 to 100, then 75, and then 50. But if there is shortage of water, then there is a lot of secretion of antidiuretic hormone, and this antidiuretic hormone helps in the reabsorption of water from these collecting tubules. And there is in fact concentration of urine, rather than decreasing concentration to 170, it may increase even to 400, 500, and sometimes it may increase from around 1200 milliosmol to around 1400 milliosmol. So the kidneys has the power to concentrate urine up to around 1200 to 1400 milliosmol. And this thing helps in conservation of water whenever there is decreased supply of water, whenever there is loss of more water than intake of water. Now this is 1400. This is in human beings, but there are certain mammals in which their kidneys have the ability to concentrate urine up to around 10,000 milliosmol. 10,000 milliosmol. And those animals are the one who live in such conditions in which there is very, very limited supply of water, and they may survive for months without drinking water. The amount of water they need for their body functions can be derived from the food only, and their urine is extremely concentrated. Then there are some animals who live in conditions where there is plenty supply of fresh water, and their kidneys have the maximum capacity to concentrate urine to around 500 milliosmol only. 500. The human kidney can concentrate it to for 1200 to 1400 milliosmol, and some mammals can concentrate it to 500 milliosmol, and some mammals can concentrate it to around 10,000 milliosmol. So it all depends upon the conditions in which these mammals are living. With plenty supply of water, the systems of the body, the kidney, have adopted to concentrating it less and less. And if there is less supply of water, very much decreased supply of water, then those mammals, they have evolved into their kidney have the capacity to concentrate it into around 10,000 or 9,000 or 8,000, depending upon different conditions. So why is it important? To conserve water, and to prevent dehydration, and to allow the body to maintain the normal conditions, which is the homeostasis. Now in the coming lectures, we will discuss into detail all the functions of the body which helps in excreting dilute or concentrated urine. Thanks a lot for watching the video.